Public knowledge about lupus is very low, and it's still a mystery. We don't know the exact cause, and it's described as an invisible illness. Unless the skin has been affected, it's hard for others to see and understand it. Quite often, patients like myself don't necessarily look ill. People would say to me, "You don't look sick," but they don't realize that it's painful, both physically and mentally, living with this condition. One of the biggest challenges of lupus is getting the diagnosis. Since the attacks can be on any part of the body, it makes it difficult to diagnose. On top of that, its most common symptoms mimics those of other illnesses. For example, if you're presenting with a fever, chest pain, and mouth sores, you'd be put on treatments for malaria or tuberculosis over and over, even with negative lab results, because they don't know what's wrong with you. And every case of lupus presents itself differently. One could have kidney involvement, another does not. So it can look a bit different for everyone. Some of my fellow patients I know have had to wait 3 to 6 years before getting a proper diagnosis. In Tanzania and Africa in general, the belief or assumption is that the prevalence of lupus is very low. I challenge this because studies have shown that women, and particularly people of color, are more likely to develop this condition. We face unique challenges that result in the lack of a diagnosis, misdiagnosis, and underdiagnosis. We also lack data. There are no solid statistics that can give a true idea of the prevalence of this condition on the continent. Some of these challenges include poor access to health care, low disease recognition related to low awareness of lupus at primary healthcare settings. There have been many occasions where some of us have gone to local hospitals and physicians do not know what lupus is and would have to explain it to them and inquire if they are able to give us the proper treatment. So the need for increased awareness is not just for the public, it's also needed amongst healthcare workers at all levels so that they can be sensitized to pick it up early and refer to specialists early. Also, there are inadequate number of specialist physicians. Tanzania has a population of about 58 million people, but we only have 2 rheumatologists. This is inadequate and it needs to change. People with lupus can attend other clinics with other specialists such as nephrologists and dermatologists. But even so, the number of these specialists that can treat lupus is low. Also, the diagnostic tests are often not affordable, and until recently, samples have had to be sent to South Africa, Europe, or anywhere else outside the country for people to get their results. It's been good fortune that as of late, our hospitals have been able to do these diagnostic tests here. When it comes to treatment, it's limited by its availability and cost. It's expensive. My own treatment can cost me up to 2 million Tanzanian shillings a month. This is not affordable for a majority of individuals, and the result is that some are not consistent with their treatment plans, and that can cause more damage and potentially loss of life. Due to all these challenges, we came together to form Lupus Warriors Tanzania. There was a dire need to advocate for the needs of lupus patients in the country, and we do this in the following ways. First, people with lupus are prescribed specific drugs and tests that are not supported by health insurances. In turn, it requires high cash expenditure out of their own pockets. Through this organization, we hope to be a mouthpiece for patients to secure essential drugs affordably through the National Health Insurance Fund. Most recently, we organized a petition to the government to include hydroxychloroquine on NHIF. At the beginning of the...
Okay, let's go do this quick.
Yeah. At the beginning. Pole. At the beginning. Isa sauce nani kwako niekeni. Just
Continue from there.
At the beginning of the COVID-19 pandemic, there was an increase in the demand for hydroxychloroquine, which led to a shortage and tripling of its prices, and therefore making it difficult for lupus patients and others to acquire it. The Ministry of Health responded to the petition, and hydroxychloroquine is now included in the standard treatment guidelines and National Essential Medicines list for Tanzania. This is a win for every person with a condition that needs to be treated with hydroxychloroquine. Secondly, being a fairly unknown disease by most Tanzanians, we raise awareness on how it manifests itself. The help and support networks are available so that it can help many people seek and get the needed help early. This will hopefully change the inclination to seek help from traditional healers, as most think of being bewitched when they do not understand the disease. Thirdly, lupus patients, especially those whose skin gets affected or have what is termed as cutaneous lupus, are often stigmatized because of how they look and because of the lack of understanding by the community of the disease. Hence, education and awareness will hopefully change the community's attitude towards lupus patients. Lastly, it's about having a platform where people with lupus and their caregivers can come together and share experiences. It fosters strength, emotional welfare, and support. Our hope is that the organization provides a platform at which lupus patients will feel happy to come home to. All in all, for improved health in Africa, we shouldn't forget about those affected by rare diseases. There needs to be combined clinical and research efforts towards improving outcomes for African lupus patients and those of other rare diseases. We must talk about it. We must get the government involved, and for it to say that this has to get just as much attention as other devastating and potentially fatal diseases. We need more research, and we need more physicians, specialists, and scientists thinking about rare diseases and working in this area. And this needs to happen now.